Obesity-linked cancer deaths in the United States have tripled over the past 2 decades, a staggering rise that signals a worsening public health crisis. What was once considered a secondary concern has now emerged as one of the most urgent threats to cancer survival, especially among already vulnerable populations. And while medical advancements in cancer treatment have improved survival rates for many, the silent force of obesity is dragging those gains backward. The numbers are more than just statistics. They represent lives cut short, families devastated, and a society paying the price of its food system, sedentary habits, and unequal healthcare access. The sharpest increases are being observed in groups who already face barriers to care: women, older adults, people living in rural communities, and those with lower socioeconomic status. For them, the rising tide of obesity is not just about weight. It's about a systemic failure to address the root causes of chronic disease and a medical establishment that is often reactive rather than preventive. Obesity contributes to at least 13 types of cancer, including some of the most deadly: liver, pancreatic, colorectal, and endometrial. Fat tissue isn't inert. It fuels inflammation, disrupts hormones like insulin and estrogen, and creates an environment where cancer cells thrive. Unlike smoking, which has steadily declined due to aggressive public health campaigns, obesity continues to rise, unchecked, unregulated, and often normalized in a culture of fast food, low physical activity, and poor education about nutrition. There's also a false sense of security surrounding cancer risk and weight. Many still believe that being overweight is mostly a cosmetic issue, or something that only raises the risk of diabetes or heart disease. But the reality is far more dangerous. For certain cancers, obesity is just as lethal a risk factor as smoking, and in some demographics, it may now be surpassing tobacco in driving mortality. Yet, public awareness of this connection remains disturbingly low, in part due to weak messaging from health authorities and deep-rooted stigmas that make open discussion difficult. Women appear to be especially at risk, particularly for obesity-related breast and uterine cancers. Postmenopausal women with high body fat are more likely to develop aggressive tumors that are harder to treat. The problem is exacerbated by age. As the population gets older, both cancer incidence and obesity prevalence increase. And among older adults, treatment is often delayed or less aggressive due to complications from obesity-related conditions like heart disease or type 2 diabetes. Rural areas, too, are experiencing disproportionate harm. These regions often lack access to specialized cancer care, affordable healthy food, and safe spaces for physical activity. Poverty, food deserts, and limited education compound the issue. In these communities, obesity is rising not out of personal failure, but out of structural neglect. And because preventive care is often delayed or skipped altogether, cancers are frequently diagnosed at later stages, when treatment is more expensive, more invasive, and less likely to succeed. The medical community is beginning to catch up to this reality, but much damage has already been done. Obesity is no longer just a background risk. It is a central, accelerating force in the cancer epidemic. And unless swift, systemic action is taken to combat it, from reforming the food industry to improving urban planning to expanding equitable access to healthcare, the number of obesity-linked cancer deaths will continue to rise. There is a clear and pressing warning in these trends. We are entering an era where the failure to prevent obesity will mean the failure to prevent cancer. And for millions, that failure will be fatal.